Living in 60 square feet with Ehlers-Danlos syndrome means the mess accumulates instantly, but deep cleaning can literally cause severe injury and pain. If you're tired of seeing perfect, high-energy cleaning montages that you physically can't keep up with, you are in the right place. Let's do a realistic low spoon van reset.
On the road to healing 1 mile at a time.
Welcome to Healing on Wheels. I'm a nurse, a van lifer, and I navigate life with a genetic connective tissue disease called EDS that causes POTS and many other chronic issues. We often see these aesthetic van life videos where people are scrubbing every inch of their rig with a toothbrush, looking all sexy and glamorous. But when you have chronic pain, fatigue, or joint instability, that level of exertion isn't just difficult, it's dangerous. It can lead to a flare-up that leaves you bedbound for days. Today I'm taking you through my monthly maintenance cleaning routine, but we are doing this the Spoonie way. That means we're conserving energy, using adaptive tools that save my wrists and back, and a whole lot of permission to be imperfect. I'm going to show you specific gear I use, like my lightweight vacuum and zipper bedding, that make this lifestyle sustainable for my body. If you struggle with keeping your healing space clean because your body is fighting you, I want you to know you aren't lazy. You're managing a complex condition, so grab your tea, maybe a heating pad, and let's get into it. Before I touch a single cleaning spray, we have to talk about the nursing side of cleaning, pacing. In the chronic illness community, we talk about the spoon theory, the idea that we have a limited amount of energy units per day. A healthy person might have unlimited spoons. I might have 12. Cleaning a van, even a small one, can easily cost 10 spoons if I'm not careful. So, step 1 is the assessment. Just like I'd assess a patient, I assess my body. What are my joints doing today? Is my heart rate spiking because of POTS? If I'm already at a level 7 pain, the cleaning waits. Hygiene and safety come first. Aesthetics come last. But today I'm feeling okay, so I'm setting a timer. I work in 15-minute bursts. This is crucial. If you have chronic fatigue or fibro, pushing through without assessing how you feel is the fastest way to crash. I also assess my hydration level and drink extra with some electrolytes if needed before I even start. I start the cleaning process by opening the doors. Fresh air is vital for a healing space. It clears out the stagnant energy and the dust. Here I'm showing you how I like to open up when the weather permits. I'm not scrubbing, I'm just moving things back to their homes or out of my sight. In a van, clutter is mental noise. When you're sick, visual clutter can actually increase your cortisol levels, making your pain perception worse. So simply clearing the countertops and having an organized space is a medical intervention for my stress levels. Notice I'm not bending over repeatedly. With POTS, the ups and down motion causes dizziness. I bring a bag or a basket to the level I'm working on, fill it up, and then move it. No unnecessary reaching or squats. I then put the stuff away as my energy permits, but the visual clutter is gone. Let's talk about the floors. In a van, the floor gets dirty fast, especially with a dog. But traditional vacuums can be my enemy. They are heavy, the vibration hurts my hands, and lugging them around is a recipe for pain. This is why I switched to the Bissell Featherweight stick vacuum. This isn't a sponsored placement, this is just a survival tip. It weighs practically nothing, and for someone with EDS where our connective tissue is fragile, minimizing the load on our wrists and back is non-negotiable. I can use this with one hand without my wrist screaming at me later. It converts to a handheld for the bed or cab, which saves me from having to wrestle with hoses and attachments. I take my time here, I'm not rushing. If I feel my heart rate go up, I sit down. I can actually vacuum half the van while sitting on the bed anyway. That is a valid way to clean. Now the rug. I use a Ruggable 2-piece system. If you have joint issues, scrubbing a rug by hand is impossible. The repetitive motion is terrible for elbows and shoulders. Most of the time I just peel the top layer off and throw it in the wash. It's light enough that I don't struggle with the weight of a heavy traditional rug. I only take the base part up if I need to mop for a deeper cleaning, but most of the time vacuuming the floors around it is enough. I toss the topper in the washing machine at my home base or in a laundromat. Being able to clean my space without physical scrubbing is huge. When you have a suppressed immune system or just need a clean environment for recovery, being able to actually wash your rugs is a game changer. If the floor is clear, I do a quick wipe down. But I'm using cleaning wipes with my feet, not a rag on my hands and knees. I never get on the floor if I don't have to. Saves my knees, only for the few minutes it takes to put the topper back on my rug if I decide to take that up, which isn't very often. Next is the bed. In a van, making the bed usually involves what I call the van life yoga. Contorting your body into weird shapes to tuck in sheets against the walls. And for someone with joint instability, that kind of twisting is a one-way ticket to physical therapy. So here's how it looks if you get inside in the morning. Yeah, so now it's all a big mess and you've got to try to tuck everything again. So this is my struggle. I invested in Beddys zipper bedding, and honestly it's an accessibility tool. It works like a sleeping bag but fits like a sheet. I could even just zip off the cover and leave the bottom on if the top of the bed gets hairy or like muddy paws on it or something like that. To make the bed, I can just pull a zipper. No lifting a heavy mattress, no tucking in sheets in the corners, no straining my back. It takes less than a minute. If I wash the whole thing, it takes about 5 minutes, which is way less energy than I used to spend tucking everything in. Plus, daily there is no bed making, only zipping. When you have chronic fatigue, saving the struggle of tucking and trying to make the bed look made every morning sets the tone for the whole day. It keeps the space looking tidy, which helps my mental health without costing me any physical spoons. The cleaning is done, but the work isn't over. The most important part of a spoony cleaning routine is the recovery. In the past, I'd push through to finish everything and then collapse, unable to function for the next 2 days. That is the cycle that we want to avoid. Now, as soon as a reset is done, I enter mandatory rest mode. I usually make myself a cup of tea. I've got my service dog in training for some deep pressure therapy, and I'm going to bed for the night since it's now so late. Normally, I would rest for at least an hour. That time isn't being lazy after cleaning. This is a recovery that my body needs. I'm letting my heart rate stabilize and my joints settle. Living in a van with a chronic illness is a constant balance of maintenance, maintaining the rig, and maintaining my body. Sometimes the van has to be a little messy so the body can heal. And sometimes we use our good days to create a healing environment. Both are okay. I hope seeing this realistic, modified routine gives you permission to adapt your chores to your body, not the other way around. You don't need to clean like an able-bodied person to have a worthy home.
But I'm right here, it's gonna be okay.
If you found these tips helpful, or if you're also navigating van life or just life in general with a chronic illness, please let me know in the comments. I really want to know what is your number one spoon saving hack for cleaning. Let's share some knowledge down there so we all can learn from each other. If you enjoyed this vlog and want to see more about healing spaces, managing chronic conditions such as EDS, POTS, dystonia, fibromyalgia, and chronic pain on the road, and of course seeing more of my cute little pup Sagie, let's hit that subscribe button and turn on notifications. It really helps the channel and helps our community grow. Remember to be kind to your body today. It's the only permanent home you have. The van is just secondary. If you want more healing on wheels, please watch a video linked here or here somewhere. Bye. We'll see you in the next video.